A lot of you have been asking if you can do ab workouts while pregnant. And the answer is yes, you can and you should be doing ab workouts while pregnant. And with the right approach, it can feel really good and supportive for your body. Hey mama, if you have been scared to do core during pregnancy or unsure what's safe and what's not, then you are in the right place. Because avoiding core work completely can lead to more pain, more instability, and a longer postpartum recovery. Hi, I'm Dr. Towne, pelvic floor physical therapist, prenatal and postpartum exercise specialist, and mom of almost 4. And today I will be guiding you through exactly how to strengthen your core safely, what to avoid, and a quick routine that you can follow along with. Your core is not just your abs. It's actually a system of muscles all working together. I compare it to a seltzer can. So you have your diaphragm on the top, your pelvic floor on the bottom, abs on the front, obliques on the side, and your back muscles in the back, all working together to create a strong system to support your growing belly and baby. So the goal in pregnancy isn't to just stop doing ab workouts. It's to train your core in a way that supports your body instead of putting more pressure on it. And if you've ever tried to do a crunch and you felt pain or pulling or just thought to yourself, this is not right, your body was trying to tell you something. Here's what most people get wrong. The problem isn't the core workouts, it's how you are doing them. As we go through these exercises, I want you to stop or modify if you notice any of these. Coning or doming in your midline, any leaking, any pelvic pain or pressure, and pain anywhere else in the body. These are signs that your core is not managing the pressure well like we need to within that seltzer can. We want to work with your body, not against it. All right, let's get into 5 safe, pregnancy-friendly core exercises that you can start today. For this core exercise, go ahead and grab a small ball and put it in between your knees so we can use our inner thighs to help us with this core exercise. Then you're going to put your hands underneath your shoulders and your knees right underneath your hips. You're going to do a really big inhale through your nose. As you exhale out through your mouth, I want you to think about hugging the baby or pulling the baby up towards your spine. Let's do a couple more just like that. So inhale through your nose, really big inhale through your nose in 360 degrees, and then exhale through your mouth. You should see their belly pull up towards your spine, just like you're giving that baby a really big hug. On this next one, we're going to do the baby hug, but we're actually going to lift the knees off of the mat at the same time. So inhale through your nose, exhale, hug the baby and lift your knees up, hold there, and then slowly come back down. On inhale, you want to relax the belly. On exhale, lift, and then lift your knees. One of the most common mistakes that I see here is women just pulling their belly button to spine and not lifting that deep and low core up at the same time. So you want to think about hugging the entire belly or hugging the entire baby, not just that belly button to spine. For this exercise, go ahead and lay on your side and you're going to prop your head on your hand or down on your arm. And we're going to lengthen our legs out from our body. This is a 2-part exercise here. You're going to go ahead and start by lifting your top leg up. Then using your hand to stabilize, you lift your bottom leg up towards your top leg. You'll be feeling your top hip and your top abs working together. And then slowly lower those legs together. So top leg, keeping hips and feet parallel to the floor. And then bottom leg up, hold, and slowly come back down. The most common mistake I see is turning out that top toe. And so then you're not going to be feeling as much in the side hips. You'll be feeling more in the hip flexor or the front of the hip. So keep that foot parallel or both feet parallel to the floor. And then you'll feel that true burn in the side hip and the side abs. Make sure you're breathing, no breath holding here. So inhale, exhale. As you lift that bottom leg up to meet that top leg, hold, and slowly come back down. For this core exercise, all you're going to need is a dumbbell, and you're going to be in a half kneeling position. So one knee right underneath your hip, and the other leg is bent in front. You're going to start with your dumbbell at the leg that's behind you, and inhale with your weight down. Exhale, reach that weight across your opposite shoulder, hold, and then slowly come back down. As we exhale, we want to be thinking about contracting our deep core, or again, hugging the baby. So inhale, exhale, hug the baby as you rotate that weight across your body, and then slowly come back down. With all of these exercises, it is easy to breath hold, but we want to make sure that we're not holding our breath, but instead we're breathing throughout the movement. Exhaling, again, the hardest part of the movement. So when you reach that weight away is when we want to exhale. We should be feeling our side abs working. Everything working together in that deep core to coordinate that movement. So inhaling, bringing that weight down, exhaling, bringing that weight across. Inhale, exhale. Again, when you're exhaling, you're hugging that baby, contracting the deepest core muscles here. You should be feeling those side core muscles working and burning. Next core exercise, we're gonna go on our hands and put them right underneath our shoulders here. We're gonna dig our heels into the floor as you make a scooping motion up with the pelvis. So you're gonna dig your heels in, and you should be feeling the backs of your thighs or your hamstrings. So these muscles back here should be burning. Those muscles, the hamstrings, attached to our pelvis, and are super important for pelvic stability. So we're gonna inhale through our nose, exhale. As you exhale, hug the baby and lift one knee up, hold a couple seconds, and then slowly lower down. Inhale, exhale. Keep your pelvis tucked underneath you. Alternate marches here. So lift one knee up, hold a couple seconds, slowly come back down. If this one gets tiring on the arms, then go ahead and drop your butt down completely and come back up. So contracting deep core on every exhale and lifting one knee up, digging the other heel in. So if you need to modify, again, drop down, take your breaks. You are doing a great job. This is a hard exercise. Nice work. We're going to go into a side plank rotation. So you have options here. As always, you can either go on your elbow or straight arm, and then you can either have both legs straight or bottom knee bent. So reach top arm up towards the ceiling. You're going to inhale as you drop your hand down towards the mat, and then exhale as you lift the arm up. Inhale down, exhale up. So if you want to make this more challenging, again, straighten both those legs. If you're shaking a little bit, that is okay. It means those core muscles are working. You should be feeling the bottom abs, the ones that are facing the mat. If you need to drop down to your elbow, you can. Inhale down, exhale up. Feeling that burn here. Again, making sure that we're not breath holding. Drop down to that knee at any point. And that's your pregnancy-safe ab workout. Simple, effective, and designed to support your body through every change. But here's the thing. What you do consistently throughout pregnancy matters more than any one single workout. That's exactly why I created Strong Expecting Mama, a program that guides you through exercises for every trimester, helps reduce pain, helps prepare your body for labor, and supports your postpartum recovery before it even begins. Click the link below to start your free 3-day trial to see if it's a good fit for you. And if this video helped you feel more confident working your core in pregnancy, then make sure you subscribe for more pelvic floor PT guidance. And send this to a mama who's been afraid to do core workouts in pregnancy. You deserve to feel strong and supported in your pregnancy. See you in the next video.